active cities and healthy cities. A little bit of my background or the organization where do I come from. Currently I'm working for this Baltic Region Healthy Cities Association, which is located in Turku, in Finland. And it's a local organization administratively, but our field of working is international, and our organization was initiated by WHO, World Health Organization, and we are a WHO collaborating center for healthy cities. More on the Baltic Sea region, but of course we also work on the European level. The organization is fairly young, 12 years anniversary this year, and the member organizations are, as I said, our local ones from Finland, but that's the administrative structure. And of course, the working field is more international, or almost only international, and we are having the status of this collaborating center for healthy cities and urban health in the Baltic region. But the working field or the approach for all the things we are doing is in this healthy cities approach, and the network of cities is the core element of the association. And what is this healthy cities approach? Many of you might be familiar with this Dahlgren and Whitehead framework of the social determinants of health, which describes that what really determines our health, and that is one of the guiding principles also in the healthy cities network. And it illustrates the idea that yes, of course, we have in the core, there are those things, age, sex, and our family with factors which affect very much on our health, and we can't do very much about them, of course. Then we have our individual life factors. What do we eat, drink? How much do we do physical activity? So, which are our own personal choices for our health. Then our social and other community networks, which also affect. But especially from the healthy cities point of view, the arch number 3, the blue arch, illustrates that a lot of things on our health and what determines our health is in the hands of the decision makers, either in the municipal level, at the local level, or national level. So how the education is organized, how the housing conditions are, what is the city planning, living and working conditions, employment situation. So a lot of things are determined by all the decision makers around us. And that's what is very much stressed in the Healthy Cities movement, that the health is determined by those who make the decisions for us. And of course, then there is the even wider general socio-economic, cultural art and conditions like climate change, cultural heritage, what we all have. So this is, these are the arches that I hope you keep in mind thinking of healthy cities, and we talk very much about those, that how do, especially in the cities, we can support or then not support our inhabitants with the decisions. In healthy cities, I'm talking now about the healthy cities, what is done at the European level in WHO. It is also a global movement, done a little bit differently in different parts of the world, but this is more the European approach. And the healthy cities has been running since 1987, 88, so more than 20 years, and it has gone in these 5 years phases of periods, and currently we are living the 5th phase. The themes have been varying a little bit from time to time. Currently, on this phase 5, the overarching theme and the goal for healthy cities is health and health equity in all local policies. It stresses, of course, these local policies, and the core all the time has been that health should be in the core of the city policies and strategies in what names they are called in different places and in different countries. So health needs to be valued by the highest level decision makers in the cities. But especially the theme of equity has raised throughout Europe, so that the attention should be on those who are in the people who are in the vulnerable groups, might be socially included, and paying attention to these health inequalities, so that we provide equal opportunities for people if they are in a poor socio-economic situation, they might be disabled, families with children. So everybody should have equal opportunities to different services. Of course, healthcare services, but also for this audience, to physical activity services. So everybody should have the same opportunities, and that's something that is not so easy in the city level to think that yes, we need to build our services to have this kind of equity lens, so that we think and see things and thinking that yeah, do we really provide our physical activity services equally to disabled people or families with children, people who are in a poor socio-economic situation. So here is a lot of text. I go back. In Healthy Cities movement, each city who wants to be participating in the network, they make their own plans and priorities, having of course in mind and are committed to these WHO principles. But the cities have freedom to do the things in a way it's appropriate for different countries, and of course it varies from city to city. Having this main theme and a lot of text is that there is also, it is split out in 3 sub-themes. And there is also, the cities should address creating and caring supportive environments, which is more a target group based approach. So that the cities should identify that yes, what are the especially important target groups or vulnerable groups in our cities. And taking Turku as an example, the groups of immigrant people and of course the aging people, which is a common phenomenon throughout Europe, are the ones that we really need to address in my city. But the situation is of course depending on the profile of each city, and the target groups need to be identified. Self-evident sub-themes for healthy cities is of course this number 2, this healthy living, which is related very much on the public health challenges we all have throughout Europe and also globally. Obesity, substances abuse, smoking, too little physical activity. So this is a topic which is really evident to be also in the healthy cities agenda. And the third sub-theme has been very strong in healthy cities since the beginning, stressing that the urban environment and urban design, urban planning is a very important precondition to support people's healthy choices. So how do we build our cities? What kind of transportation do we provide? Do we build easily accessible walking and cycling paths? So urban planning is even more important than organizing healthcare and social services, because they take care of when you are injured, or they take care about this treatment. But with the urban environment, we create the possibilities for healthy choices. So the cities make their own plans within the Healthy Cities network to address these sub-themes, and all the time having this equity lens in all of these issues. That when we filter services or counseling. So do we address the vulnerable groups in our cities? Here's an illustration of the European capacities at the moment. The list is long, so that's why it's difficult to see the names. There are around 100 cities in the network. There are reds and blues. The red ones are officially designated, and the blue ones are still in the application phase. But this is from June, so the situation has changed. So you can anyway have an illustration on where are the most of the dots, which is UK and this Turkey and Italy have been fairly active in this. And you have to remember that WA South Europe is a wide area. It includes 52 or 51 countries, so there is a lot also these non-EU countries in Europe. I take only one example from the cities, although for a Finn it's sometimes hard to say that something good is done in Sweden, but anyway, this time I can do it, because the city of Helsingborg in southwest Sweden is very advanced in healthy cities development. This is just one picture of how they have said that yes, these are the 7 areas of action where we concentrate in our activities. But they really have